Coming up on Medical Economics Weekly, primary care doctors generate more hospital revenue than specialists. 44% of eligible providers have received EHR incentive payments, and the FDA launches an online patient network. All of that and more coming up. You're watching Medical Economics Weekly. I'm Kevin Stout.
I'm Brandon Glenn, and this is the show where we keep you up to date on trending news about healthcare, practice management, and healthcare social media.
A new study reveals that primary care physicians are generating more revenue for hospitals than specialists. While specialists are earning more money and many are incredibly important to hospital revenue, the survey shows that primary care doctors are leading the revenue stream. Forbes reports that because ACOs and other new approaches to healthcare delivery emphasize lower-cost outpatient care, revenue to hospitals from specialists like cardiologists and pulmonologists is dropping. According to the Merritt-Hawkins survey of over 100 hospital CFOs, primary care physicians generated $1.56 million in average revenue for 2012 compared to the $1.4 million for specialists. This data shows a complete reverse of the data from 2010 when specialists brought in more revenue at $1.6 million compared to the $1.4 million primary care doctors brought in. The Forbes article makes some surprising comparisons. For example, a non-invasive cardiologist would generate about $2.6 million for a hospital in 2002. Today, they generate less than half that amount at $1.2 million. It also noted that specialists that focus on elective surgeries, like ophthalmology, also dropped in revenue by as much as half due to the sluggish economy.
Our next story illustrates that while doctors may dislike the electronic health record systems that are on the market today, one thing they do like is free money. The federal government reports that 44% of eligible providers have received EHR incentive payments for, quote, meaningful use, unquote, of the technology. That equates to about 230,000 providers overall who have received the payments. The federal government's EHR incentive program began in 2011 and has so far awarded nearly $14 billion to providers for adopting electronic health records. But all is not rosy with the EHR incentive program. A recent report issued by 6 Republican senators expressed concern that the program is spending billions of dollars of taxpayer money ineffectively.
The FDA has officially launched its online patient network. The new site is an educational tool for patients to learn about how medical devices go from idea to marketplace. The patient network has been in development for almost 4 years, since 2009, when the FDA Office of Constituent Affairs started working with the FDA Commissioner, Margaret Hamburg, to discuss the future of the site. One interesting use for the site is for patients interested in getting involved in clinical trials. James Valentine, a program analyst at the FDA, was quoted by Health 2.0 News. They don't always necessarily know what they want from the FDA, but a lot of the time, patients who have contacted us are very frustrated. They've run out of options and they just don't know what else to do because they're not allowed into clinical trials. And so we help them work with sponsors and their physicians to get access to investigational products. The site is also planned to host live chats with senior agency officials and provide a platform for consumers to contribute their ideas about medical device regulation.
Recent research in the New England Journal of Medicine examined drug and device industry payments to physicians in Massachusetts. Researchers found that in a 2.5-year period, the percentage of physicians who receive industry payments varied widely by specialty. For example, just 21% of family physicians and 12% of pediatricians received industry payments, while 61% of urologists and 57% of gastroenterologists had received payments. Industry payments to physicians has become a hot topic in the medical industry because the Federal Physician Payment Sunshine Act is scheduled to take effect on August 1st. After that date, companies are required to report physician payments of more than $10 to the federal government, and the government is scheduled to post that data online in 2014.
It's getting easier for patients to communicate about healthcare online. A new social network called HealthKeep has recently released, allowing patients to share a timeline of their symptoms and medications. The network complies with HIPAA by keeping users anonymous if they wish to be. HealthKeep has a place for doctors in its network as well. Doctors can register on HealthKeep and create a verified account that can post to the site, receive a personalized health newsfeed, and answer questions that the community members ask. Patients can also add any and all of their doctors to their profiles. HealthKeep maintains profiles for almost all of the practicing physicians in the U.S. Patients that have added their doctors will see a general announcement or news that doctors post to the network. HealthKeep was founded by Dr. Lyle J. Dennis, a neurologist with 17 years of clinical practice experience. He sees HealthKeep as a powerful new way to improve healthcare.
A survey from the Medical Group Management Association finds that median first-year guaranteed compensation for primary care doctors stood at $180,000 last year. The good news is that the figure was up slightly from the prior year, by about 3%. As you'd expect, primary care compensation was far lower than several subspecialties. For example, for non-invasive cardiology, compensation was about $333,000, orthopedic surgery about $283,000, and dermatology stood at about $227,000. Nonetheless, recruiters and staffing firms say that primary care physicians are very much in demand, and that's why hospitals and health systems are using perks like signing bonuses, paid relocation, and loan forgiveness to help recruit primary care physicians.
On the medicine page of Reddit, a user asked North American doctors about their opinions of doctors from the United Kingdom and if there were any obvious differences in schooling, attitudes, or practice. We found a few interesting and humorous comments to share with you. One user wrote, "The only thing that I've seen is that one of my colleagues fresh from the UK tried to order a beer at lunch at the hospital McDonald's. I thought it was hilarious that he was going to drink at work. He thought it was insane that there was a McDonald's in the hospital." Another user wrote, "A consultant attending over there told me that UK students are meant to be learning all the time and shouldn't have to worry about day-to-day tasks to ensure hospital function. It wasn't uncommon for the UK students to take a day off from the hospital and just study for the day. I'd get crucified for doing that in the US. And now for our tweet of the week. In response to an article published in the May 10th issue of Medical Economics, user Doc Rockney commented on the stat, "Hypertension affects 1 in 3 adults and is responsible for almost $50 billion in medical expenses each year." He replied, "And can be treated with all sorts of $4 generics. #shameful. Thanks for your feedback, Doc Rockney. And to be featured here, mention us on Twitter @MedEconomics.
Thanks for watching Medical Economics Weekly. To get more episodes as they're released, please subscribe to our YouTube channel, follow us on Twitter @MedEconomics, or like us on Facebook at facebook.com/medicaleconomics. And please send suggestions and feedback to bglenn@advancedstar.com or kstout@advancedstar.com. Thanks for watching, and we'll be back soon with more healthcare and practice management news. Don't miss it.